So we're going to review some very important concepts. Evidence-based practice. This includes research findings, knowledge from basic science, clinical knowledge, and expert opinion should be considered sources of evidence-based practice. Outcomes of clinical trials. So evidence-based practice is fairly new to the United States, but it's what should be guiding our actions and the interventions that we are implementing. Evidence-based practice should guide our interventions. We should recognize current practices and be able to identify gaps and additional resources needed to follow best practice guidelines. We should assemble an interdisciplinary team to guide and review the evidence process to establish best practices. We want to identify issues and barriers to implementation and recommended interventions based on the research. So the evidence-based practice, all of the information that we gain from research and knowledge from basic science and clinical knowledge, all these are the things that should guide our practice so that we can provide the best care possible. Levels of prevention, we know we have primary prevention, secondary prevention, and tertiary prevention. Primary prevention refers to actions taken to prevent the disease from occurring. So there is no disease process, there is no injury, there's no disability or deficit. These are all ways that we can provide some type of education, whether it's through a pamphlet, face-to-face, Zoom, but there is not a disease process there. There's no deficit or injury. Secondary prevention is when we are detecting, we're screening, we're doing that surveillance, trying to determine whether or not there is an injury or some type of disease process that is present. For tertiary prevention refers to actions taken after a disease has already occurred or an injury has already occurred. So that would include observation of medication, someone taking their medications. That would be an example of tertiary. Again, tertiary prevention includes those interventions aimed at disability limitations and rehabilitation from a disease, injury, or disability. Primary prevention and health promotion, they both address the use of interventions before the disease occurs and to reduce the risk of developing disease. Secondary prevention is aimed at detecting disease early through screening programs and early intervention for at-risk individuals. Health disparities include limitations in physical resources, environmental resources, personal resources, and biopsychosocial resources, which cause vulnerability. For example, migrant workers who have less human capital because their transient lifestyle causes disruption in education because they're always on the move. So therefore, their income might not be stable because of that, but because they're migrant workers, they must move around. That's just like one of the downsides to it. Poverty does contribute to social conditions in which disparities develop. The WHO, the World Health Organization, consistent with Healthy People 2030, describes three overall determinants of health to be the social and economic environment, the physical environment, the person's individual characteristics and behaviors. The World Health Organization also notes that individuals are unlikely to be able to directly control many of the determinants of health, and this is directly related to vulnerability. The 7 WHO factors are: 1, income and social status. Higher income and social status are associated with better health. And that's just because it's believed that if people can afford health insurance, more than likely they will have it, subscribe to it, then more likely they will actually go get those preventative services in which disease processes are detected earlier. The next factor is education. Low education is linked with poor health, more stress, and lower self-confidence. Physical environment is the third factor. Safe water and clean air, healthy workplaces, safer homes, communities, and roads are good employment and working conditions, especially when the person has more control, all contribute to good health. Social support networks, families and friends and communities, as well as culture, customs, traditions, and beliefs affect health. Genetics, as well as personal behavior and coping skills, affect health. Health services assess and the use of services also affect health, because remember, if a person do not have the resources, the specialty doctors that are needed where they're located at, then that presents a problem. And that is called having access to services. Men and women suffer from different types of diseases at different stages, at different ages. So when we're talking about vulnerable populations, the people that are at greater risk are the ones that have multiple of those factors that we just described. A vulnerable population group is a subgroup of the population that is more likely to develop health problems as a result of exposure to risk or to have worse outcomes from these health problems than the rest of the population. We have identified vulnerable populations as migrant workers, veterans, homeless, the very old, the very young, also those that have chronic diseases. The interaction among many variables create a more powerful combination of factors that predispose the person to illnesses. Vulnerable populations often experience multiple cumulative risks, and they are particularly sensitive to the effects of those risks. Risks come from environmental hazards, for example, lead exposure, from lead-based paint, from peeling walls, or paint used in toy factories. Social hazards. Examples of that is crime, violence, and riots. Personal behavior. That includes diet, exercise habits, smoking or use of drugs, or biologic and genetic makeup. Members of vulnerable populations often have multiple illnesses, with each affecting the other. Genetics also plays a role in vulnerability and influences a person's resilience to adverse social economic conditions. Healthy People 2030 sets national goals and measurable outcomes to guide evidence-based policies and programs. Overarching goals of Healthy People 2030 include promoting healthy development, healthy behaviors, and well-being across all life stages. It includes engaging leadership, key constituents, and the public across multiple sectors to take action and design policies that improve the health and well-being of all. It includes those overarching goals include creating social, physical, and economic environments that promote attaining the full potential for health, well-being for all. eliminating health disparities, achieve health equity, and attain health literacy to improve the health and well-being for all. Attain healthy, thriving lives and well-being free of preventable disability, injury, and premature death. Healthy People 2030 is for everyone, it's for all, and it addresses all different circumstances, disease processes, everything from A to Z. Motor vehicle accidents are the leading cause of death among children and teenagers. Therefore, creating careful driving programs would be essential to help and assist with decreasing this fact. We do know obesity is another problem that is affecting our school age children. Interventions need to be based on goals of lifestyle changes for the entire family, not for just that one child. But if you can change the lifestyle change for the entire family, the child will have more buy-ins, and the family in a whole would be affected positively. The goal is to modify the way the family eats, exercises, and plans daily activities. Changes need to be made at a more direct level, such as by working with family to establish the change. The key is involving the entire family. Remember, a dual power of attorney is a legal way for a client to designate someone to make healthcare decisions when he or she is unable to do so. And the living will allow the client to express wishes in writing regarding the use of medical treatments in the event of a terminal illness. Remember, our very old and our very young are most at risk for being abused. Children in their first year of life have the highest rate of victimization at 26.7% per 1,000 children. Motor vehicle related injuries and violence are the leading cause of morbidity and mortality among adolescents. Males are more likely to take risks, and injury death rates for boys are twice as high as those are for girls. So when you're interacting with a parent and trying to come up with that careful driving program, you want to encourage parents to think about the risky behavior specific to the population, which is the adolescents, and then how they might apply to their child. The use of a medical home is when there is one provider or a clinic that has all the children's records. And it is important for this population of children that might have some kind of disease process. Communication among all the specialty doctors or healthcare providers is essential. You want them to be working with the child, and is essential in order for the child to achieve the optimal health and functioning. Again, we were talking about the use of a medical home. You having all of the child's information in one place. And then there is communication among all those healthcare providers, all those specialty healthcare providers that are assisting in providing care for that child. Family systems typically maintain stable patterns, although families do change constantly in response to stresses. Change in one part of the family affects the total system. However, if family members are supportive, they will want to try to help the ill member. Therefore, the member who prepares meals will probably compromise by trying to meet the ill member's needs without making drastic changes in the overall eating patterns of the family. Healthcare function. Families teach members the concepts of health promotion, health maintenance, disease prevention, and illness management. Family members provide informal caregiving to ill family members and are the primary source of support. An example of that is someone is taking care of, for example, aunt taking care of a niece that is homebound, or a child that's taking care of a parent that is homebound. That is healthcare function. Health risk appraisal refers to the process of assessing for the presence of specific factors in each of the categories that have been identified as being associated with increased likelihood of an illness. For example, such as cancer or an unhealthy event, such as an automobile accident. Remember, your nursing projects, community nursing projects, they do require that there be a partnership with both nurses and the local businesses to have success. You need to buy in. For the most part, they are there to provide that financial support. They're there to encourage the community members to take part in, because the community members will see, well, hey, this is a person that we trust of the community. So if they're encouraging us to participate, then more than likely they will go on. So those partnerships are very important. Federal health agencies are Centers for Disease Control and Prevention, National Institutes of Health, agencies for healthcare research and quality. So quality and safety in nursing education is not a federal health agency. They make recommendations and set guidelines for practice. So those federal health agencies were Centers for Disease Control and Prevention, National Institutes of Health, Agency for Healthcare Research. And we have all just been about COVID out, but remember, we do think COVID existed in the United States back in December of 2019. But COVID was first identified in December 2019, originating in Wuhan, China, as a new virus that had not yet been seen in humans. To this date, there's no evidence to suggest that these individuals from Asian Pacific regions are at higher risk. The virus spread worldwide. The CDC did not declare the virus a national emergency in 2019. The first case of COVID-19 was discovered in the United States in January the 20th of 2020. On March 11th, 2020, the World Health Organization declared the virus, which is known as COVID-19, as a pandemic. We talked about having that access to healthcare. The Affordable Care Act, it had two main features, and that was increasing that access to affordable healthcare and improving quality and lowering those costs. Healthcare costs in the United States are the highest in the world and comprise the greatest percentage of the gross domestic product. The indicators of what constitutes, good health do not document that Americans are really getting their money's worth. Risk reduction is a complex process that requires knowledge of risk and families, perceptions of the nature of that risk. So when you're trying to implement a risk reduction intervention, you want to see how the family perceives that risk. They might not even think that it is an issue. You want to ask questions to determine the family's perception of the risk. If the family does not perceive the behavior as risky, but rather as necessary, for food or just for entertainment, you first want to educate or persuade the family that others may be more comfortable if certain precautionary measures are taken.